Gender-based violence is a global public health problem of significance. But we can address this pervasive problem based on the tools and the evidences that we have available now. Gender-based violence is an umbrella term for any harmful act that is perpetrated against a person's will and that is based on socially ascribed gender between males and females. Gender-based violence against women is a life-threatening global problem and human rights issue. While men may experience gender-based violence, in general, women are more affected. A recent global prevalence study by WHO and partners shows that almost 1 in 3 women have experienced one or more forms of violence, either from their intimate partner in their lifetime. This shows that this is still very much prevalent around the world. And it remains a major problem that affecting the lives of women and girls across the globe. Coupled with the upsurge that we have just seen during the COVID-19 lockdown in gender-based violence, it is now more important to put this into perspectives and to look at actions that we can implement to addressing this problem. Although this problem is a global problem, there are different levels of prevalence all around the world. We can see from this map the deep red areas have prevalence of above 40% or equal to 40, while the light blue have between 15 to 19%, and the other shade of blue is from 10 to 14, and the green is between 20% to 24% prevalence. This shows that this problem is global. All the continents and all the countries are affected, and it requires a global intervention. For adolescent girls, this problem starts early in the lives of women. 1 in 4 adolescent girls 15 to 19 years old is estimated to have been subjected to physical or sexual violence from an intimate partner at least once in their lifetime, according to the same global estimate. Where when you look at young women 15 to 24 years, 16% of them have experienced violence within the past 12 months. The impact of GBV is throughout the life cycle, right from pre-birth to old age. For example, sex-selective abortion is a form of violence, which occurs at pre-birth. And we have violence during infancy and childhood. This includes female infanticide and female genital mutilation. At adolescence, we have forced prostitution, trafficking, forced early marriage, rape, sexual harassment, etc. And older women are not also spared. Elderly and widow abuse is very pervasive. Throughout the life cycle, this violence have significant impact on health. This includes infant and child mortality, to low birth weight, to poor mental and physical health, depression, anxiety, substance abuse, suicidal ideations, suicide, unintended pregnancies, unsafe abortions, pregnancy complications, sexual risk-taking, STIs, and HIV/AIDS. But the impact of GBV is not limited only to health. We have intergenerational and socioeconomic consequences. This can be as a result of effect on children of women who experience abuse. This may include behavioral problems in those children, anxiety and depression, attempted suicide, poor school performance, and experiencing or perpetuating violence when they become adults. This is the intergenerational effect, which is very grave, and also lost in productivity in adulthood. Generally, the effect on the family may be around inability to work, low wages, and instability at home. And the social and economic effects may be around the cost incurred taking care of survivors and their families, loss of workplace productivity and cost to employers, and the perpetration of violence. So what are the risk factors? From the women's experience, based on a multivariate analysis involving 10 countries, the risk factors may occur prior to relationship and during the relationship. So, and then there are also protective factors. Risk factors prior to relationship are around history of abuse, history of being from a family where the mother has been abused, someone who has been abused in their childhood. And then at this period, a protective factor that has been identified is education. Completed secondary school education is a protective factor at this level. During the relationship, some risk factors that have been identified include attitude of the man, condoning the attitude of the man, the reasons for the man to hit a partner is a risk factor, and the use of alcohol and substances, heavy drinking either in the man or the woman, that's the risk factor. And if the partner has had concurrent relationships, it's also a risk factor that's been associated during the relationship itself. So, but the protective factor around this period include the household socioeconomic status, the level of wealth in the household is a protective factor against gender-based violence. From the point of men who are perpetrating intimate partner violence or gender-based violence, a similar multivariate analysis from 6 Asia-Pacific countries identify some of the risk factors around gender norms and practices. This includes quarreling with partner, frequent quarreling, transactional sex, low gender, equitable attitudes, and 2 or more lifetime partners. So we also have other risk factors around the victimization history of child abuse, being abused as a child, physical or sexual, childhood emotional abuse or neglect, and the witness of mother being abused are risk factors in men. Psychosocial risk factors include depression, use of alcohol and substances, and lack of higher education and current food insecurity are also risk factors. But gender-based violence is preventable. There is hope, but it requires multi-sectoral action, which span across different sectors and at different levels. Also, laws and policies that support and strengthen gender equality, and programs that challenge gender norms and acceptable low status of women and girls, whether they are school-based programs or community-based, they are workable. And this includes comprehensive sexuality education, access to higher education for girls and women, and the access to safe paid employment, decent wage, microfinance, and including cash transfers, and addressing exposure to violence within family and violence against children are also some of the interventions that can be used to ameliorate this problem. So these interventions can be implemented at different levels: individual, relationship, community, and societal levels. And basically, these interventions address the deep-rooted gender inequality within the community. And also there are programs that reduces violence against women and the risk factors at multiple levels. Some of those interventions may include programs that address prevention of child maltreatment at the individual level, programs that promote gender equitable attitudes and behavior at relationship level, and at community level, programs that promote equitable gender norms through the media, community mobilization, schools, and religious institutions. And at societal level, programs that reduce substance abuse and abuse of alcohol, and generally programs and policies and laws that promotes women access to employment and microcredit, and the access of women and girls to education are very successful programs at the societal level. So WHO and partner have come up with the 7 strategies referred to as RESPECT, RESPECT. This is a multi-agency strategy led by UN Women with WHO and other partners involved. So this summarizes the strategies that can be used at these multiple levels. The R stands for relationship skill strengthening, E for empowerment of women, S for services ensured, including police, legal, health, and social services. Poverty reduced, that is P. E for safe environment, environment made safe. C is for child and adolescent abuse prevented. And T is for transformed attitude, beliefs, and norms. So implementing these prevention strategies at multiple levels within the society will help in preventing gender-based violence. The health sector also has a big role to play. The health sector usually is the fourth port of call for survivors. That's where women who have been abused go to take care of themselves. So health sector can provide women-centered care and first-line support, identify survivors of intimate partner violence, provide comprehensive care and support for survivors, training of healthcare providers, and collection of data for service delivery and coordination. Health sector also has a big role to play by incorporating the prevention strategies into their interventions. So the key message is that gender-based violence is still a global public health and social problem which is preventable. There are promising prevention strategies and guiding principles for implementation, which is summarized around the acronym RESPECT, RESPECT. These strategies can be implemented across sectors and across multiple levels. Interventions that are very successful for low and high income societies have been identified within RESPECT, and they're currently being implemented by various partners. So we all have a role to play. In our programs, we can incorporate messages about prevention. We can also implement prevention services as part of our corporate social responsibility or part of our services. And more importantly, we can all be advocates with our peers within the communities and with leaders in order to change this situation. Thank you very much.